The TMJ-TMD conundrum is real and has been puzzling the dental and medical professions for decades. This is the TMJ-TMD Demystified podcast with Dr. Tony Urbanek, where we'll connect the dots between TMD symptoms and the actual cause. We'll tackle common TMD misconceptions and educate you, the practitioner, about a simple, tested, and proven TMD solution that has already provided relief to thousands of patients, while helping practitioners build an additional source of income free from insurance control. Welcome to this episode of the TMJ-TMD Demystified podcast.
All right, welcome everyone. We are here for the next episode of TMD Demystified. I am Tony Urbanek, and we have a special guest today on this episode that I discussed a couple weeks ago. I said we're going to have a really special guest on a Tuesday. What is the date today? 16th. Our guest for today is Katie Richards. Katie is a patient of mine, and she has came into our practice because of her temporomandibular joint symptoms. And we are here today to discuss the topic of the day, which is the correct role for orthodontists treating TMD, temporomandibular joint disorder. There's a great number of orthodontists in the United States of America who attempt to treat temporomandibular joint disorder, TMD, telling the patient or parents, both adults and children, that the correct solution for their TMD problems is orthodontics. Now, I have a disagreement with that, and we're going to kind of discuss that today as it applies primarily to children, where I'll allow Katie to tell her story. But Katie has been a great patient, and we've given her some significant assistance in her temporomandibular joint issues and problems. But I want to just start out with letting Katie to introduce herself and tell the audience a little bit about herself and where she comes from and about her little personal life. Katie just got married. I mean, just a few days ago, Katie got married. And I really appreciate her coming on with us today and helping the people who watch and listen to this podcast to help both dentists, orthodontists, and public and patients understand this problem that we're going to discuss. So, Katie, if you would take a few minutes and tell the audience a little bit about yourself, I think they'd be very interested to hear.
Okay, great. My name's Katie Richards. I've grown up in the Nashville area, born and raised. I'm an interior designer. My husband's a state trooper. We absolutely love Nashville and plan to stay here. So yeah.
Okay. So let's just talk about your history with orthodontics to begin with, because as I understand it, and as you told me in our original consultation, that you had quite a history doing braces, orthodontics, actually had two separate orthodontic cases done or treatments done by, was it by the same orthodontist or two separate orthodontists?
So I started just at a dentist and then they referred me over to an orthodontist. But the dentist started doing work first and the orthodontist stopped them because I was way too young. So then I was with the orthodontist for several years after that.
All right. So how old were you when the orthodontist, or excuse me, your general dentist started to try to do orthodontic treatment?
I remember, I think it was around like late preschool is when they started noticing I had jaw issues. I had an extreme underbite, so it was difficult for me to eat and to talk. So the dentist wanted to start addressing that with an expander. So that was going into like kindergarten, first grade, I would say, when they put the expander in. And then I can't remember if we were referred to the orthodontist or my parents were like, I'm way too young. let's go somewhere else. So ended up going to the orthodontist, and they started work early elementary school.
What age do you recall, approximately what age you started with the orthodontist?
I think I started when I was around 8, 7 or
Okay,
8. That was around second grade.
okay.
I didn't end orthodontist work. Well, I got braces off and then done with all the headgear my first part of high school. I was 15, and then I still had a retainer up until I was diagnosed with the TMD.
So you started orthodontic treatment with an orthodontist in second
Yes.
grade,
Yes.
and you were under active treatment with him until age, did I hear you correctly, 15?
Mm.
How many years would that be?
Is that like
You do the math.
almost 9, 8 or
All
9?
right, let's talk about this in detail. No, I'm learning more about your case
Yeah.
as we discuss this.
Hmm.
So you were in active orthodontic treatment for 9 years. I just want to make sure we're both in agreement on that.
Give or take, yes.
Yeah. All
Yes.
right. Now, as best you can recall, tell those watching and listening what actually was the orthodontic treatment. I heard headgear, and
Yes,
of course you had some wires and brackets on and things like that.
I did. So they pretty much immediately put me in the full set of braces, top and bottom, um, to try and align my teeth first. And then they were trying to make my lower jaw smaller, to align it to where my teeth could actually go over top of each other. I had the rubber bands that attached to both, that would pull my jaw. I did have headgear. That was on the early stages is when I had headgear. So that was elementary school.
Can you describe? I know what headgear is, but I think that probably very few of the
Yeah.
public understands what a headgear is. So, if you
Yes.
describe what a headgear is.
Okay. So I only had to wear it at night. It was very uncomfortable and super itchy. There was a pad on your chin, a pad on your forehead, some small metal wires that connected the two, and some that went forward that had these, it looks like a claw, and it would attach the rubber band that was on my brackets up onto this claw. And I would sleep in it at night, every night, up until they told me I was cleared from wearing it.
About how long was that you wore your headgear?
Um, I would say it was all through elementary school. I don't really remember a time I wasn't wearing it.
So how many years would you say that was? Second grade to eighth grade?
3.
Three
I think
years
I only wore it for about 3 years.
until middle school.
Yes.
Okay, so 3 years you wore headgear.
Mhm.
How did that tell me? I'm interested in how that felt. Tell me how the headgear felt to you. What did you
Um,
think? What did you think of wearing headgear for 3 years? What did
well,
that mean to your life?
I hated it, honestly. I didn't want to go to sleepovers with it. I would refuse to wear it, like if I had a sleepover. Because it was like embarrassing a little. There were times where there was so much padding on it and it would itch and rub. So, my skin was really irritated. So we had to come up with all these like weird looking con- I don't even know how to call it, but it was really uncomfortable. It wasn't fun. You'd wake up with the line down your face, and the rubber bands would snap back at you if you didn't make it on the claw, and it was a pain, honestly, and I hated it.
Well, I'm not surprised about that, but I wanted the public to know and the dentist to know, what it's like for the patient to wear
Mhm.
headgear.
Yeah.
So, all right. So now we're in approaching high school. You're in middle school. You've been in headgear. They decided, well, headgear, whatever the decision was, either it wasn't working or they're finished with it or
Mhm.
whatever it was. What do you recall about your parents' reaction or their statements about all of this? If you have any recollection, were they supportive about having 8 years of orthodontic treatment? Did they think that was
Mhm.
normal, or did they just go with it? Do you recall anything about how your
Yeah.
how your parents felt?
I remember them being frustrated, I think. That's a big financial burden on them for that long. on top of having multiple children. I don't think it was very fun for them. I mean, that's an inconvenience to take your kids to all these appointments all the time, and it just taking so long to be fixed. Um, you know, the solution that they said, if I didn't go through the headgear, I was in a Frankel, which was that full mouth guard that I wore at night at one point, stayed in braces the whole time. I think it was just irritating for them. I think they felt bad that, it wasn't comfortable for me at all. And then not only that, but again, it was a financial burden to them. And then, yeah, I would really just say that.
All right. You mentioned the word Frankel. Can you talk about, would you describe what I know what a Frankel is?
Uh-huh.
Would you talk to the public and the doctors listening about what a Frankel
Yeah.
is?
Um, I remember there's two like plastic hard pieces on the sides. And then
Does it
I
fit
had
in the upper or the lower jaw?
both. I had to get
Okay.
both jaws, the
Uh-huh.
plaster that the molding.
So it fit
Um,
inside the mouth, right?
yes. So it
Okay.
wasn't fun to get in. It was very large. So you'd have to like put one side in and then the other. And my teeth would just kind of sit in it. So it really was just the moment I went to sleep, you put it in. Because you can't really talk with it. It doesn't hold your jaw together or anything. It just kind of sits it in place, is what I remember.
Okay. And how long would you estimate you were in the Frankel appliance?
I was not in it for very long. I don't
Couple
even think, I
months?
think it might have been, yeah, maybe up to a year. I don't remember at what point I was in it. I think this was around sixth, seventh grade. But it wasn't very long at all.
Okay. All right. So let's carry it forward. Now you're in sixth or seventh grade and they finished with the Frankel. You had been in
Hmm.
a head frame.
Hmm.
Uh, Now we're approaching 6 or 7 or 8 years in the process.
Hmm.
Um, Talk about the end of this, the end of the orthodontic treatment. When you were
Yeah.
15, now you're
Hmm.
15, you're in
Hmm.
high school,
Yeah.
you're a young lady having a good time in high school, I hope, right?
Hmm. Yes.
And actually,
Yes.
and you said you met your current husband that you
In
just
high
married
school.
in high school. How
Yeah.
old were, no, I'm getting a little off track, but how old were you when you remember what age you were when
I
you
was
met your husband?
16.
You were
Yes.
16 when you met your husband. All right.
Yes.
So, but you got rid of the braces by the time you got to meet
Oh,
your.
yes. He did not know me with braces.
All right. All right. So let's talk about the end point of the orthodontic braces. When you
Yeah.
finished up,
Hmm.
um, was there any discussion either with you and the orthodontist or with you and your parents or with the parents and the orthodontist about the final outcome of this? Was everybody happy with it? Was the orthodontist happy with it? Were your patients happy with it? Were you happy with it?
Yeah. So by the time I was done, I my underbite was corrected. My teeth were very straight. It all fell how the orthodontist said it should. I was given two retainers, one that fits in the bottom, one that fits down below, and there would be rubber bands. So I would just keep consistently wearing that pretty much forever, just at night, to make sure, if my jaw did shift, it could go back. So I was in that up until pretty much now before I got my device for the TMD. Um, so, I mean, I had no pain for years. I made it through high school, made it through college. My jaw did start to shift a little bit and it wouldn't really go back. And that's kind of when I started to notice a little bit of discomfort, was when my jaw shifted. The retainer at night wasn't moving it back. And I just couldn't get it back to where it originally was when I did end the orthodontic work.
Okay. So you started after a while, after a few years. You said you were in college when you first started having some issues of uh, TMD. Is that
It
what I
was
heard?
it was right outside of college. It was actually a year ago.
Okay.
I was 6 months out of college. I went through a lot of stressful events that I wasn't expecting. And that's when I really noticed an issue. I had talked to my dentist about it, my PCP, and I was like, I am in a lot of pain. It hurts to eat, it hurts to talk, it hurts doing nothing, and I don't know what it is. And they didn't really give me any answers. They kind of just dismissed it. You know, I wasn't sure if maybe it was something wrong with my lymph nodes or my ears, because I was like, it's so painful right here, and I don't know what's causing it. And that was ignored for a really long time, even when I addressed it with other doctors, just not sure where to go.
So, did anyone did the orthodontist ever mention that pushing on the jaw or having this kind of treatment could potentially create any problems with your jaw joint? Did that
No,
come
no,
up at all?
not at all. I remember them saying if my jaw didn't stay in place, the only other option is where they surgically break the jaw to put it where it needs to go.
Okay.
So that was the only other alternative that I had heard.
All right. So to fill in the blanks for those listening, let's go forward a little bit now to where we did a consultation a few months ago, and you came in, referred in to see us, and I listened to the history, and I decided to recommend this little device that we put in your mouth to make the symptoms go away, right? This little thing that fits in the roof of the mouth, right? So we don't have to talk in detail about it, but how did that go for you? Once we
The
got the treatment, yeah.
Yeah, so of course it was a little difficult to talk at first. My mouth didn't know how to lay over the device. But within, I think, a day and a half, I got used to the feeling of it. It took me about a week and a half to figure out how to pronounce my S's and T's
Right,
correctly.
right,
um,
right.
and of course, working in a industry where you're talking to people all the time, that was a little challenging, but it was kind of a fun icebreaker when they would ask like what's in your mouth, and I would explain it's not Invisalign, like this is what it is. Um and I mean, it ended up being great. I think within the first week I already noticed a small depletion of the pain here. It didn't feel as tight anymore in my jaw, um which is something I noticed. So I think that was an immediate, I don't know how long it would take to get the symptoms to be zero, but I think this is exactly where I needed to go.
And so how are you doing now with your pain and discomfort and the original symptoms? What percentage of your original symptoms that you came in with, which are on my note here, you had a short list, you did not have a big list. Your list was just jaw pain and feeling of
Mhm.
fullness in your ears, like your ears were full of water and it wouldn't clear.
Yeah, I would say 80 to 85% of the pain I started with is now gone. I don't have to wear the device during the day now and only have to wear it at night. We did figure out about a month and a half ago that my lower jaw has a very wide range of motion. So my jaw was actually slipping off the device. So they did have to make it larger. But the moment they made it larger, um, my jaw wasn't slipping anymore. I wasn't waking up with slight discomfort. So it's been great the last month, especially with the new device that I got, the recreated one. It's been wonderful.
All right, so let's talk about your bite now, because I noted when I did my initial consultation, I walked in the room and I said to myself, this young lady has a jaw growth problem, right?
Mhm.
And then after I did the consultation with you, then I brought it to your attention and asked what you thought about it. So a jaw growth problem, um, for the uninitiated is a growth problem that can happen both to the upper and lower jaw at various kinds and degrees. I spent literally my entire 50-year career as an oral and maxillofacial surgeon fixing these kinds of problems. But I want to cone in on what I saw and what you see actually as it has right now. Jaw growth problems originate primarily at the center of the major growth center of the lower face, the entire lower face, is the temporomandibular joint. That is not my idea. That is the scientific proven concept that the major growth center of the lower face originates at the temporomandibular joint. And in your particular case, excess growth of the lower jaw originates at the temporomandibular joint and the entire jaw. So, but right now, with now 8 years of orthodontics under your belt, and now that your temporomandibular joint symptoms are under control using a very simple device, what is your perception? What is your perception of your bite itself? In other words, the way your teeth fit together,
Mhm.
and the way it looks, because there are two components to a jaw growth problem or a facial growth problem. It's both functional and aesthetics. Patients complain of different things about function, and they complain about different things about the way it looks. And after 50 years of doing several couple thousand or more um, surgeries on fixing jaw or facial growth problems, I've heard it all. So, but
Mhm.
I want to hear what you have to say about it. And I'm
Yeah.
really interested because I'm not sure I ever asked you that question before.
um, of course, my jaw hasn't moved forward. You know, I don't have an underbite anymore still. It's still where it needs to be. But now my back teeth just touch, which can be uncomfortable at times. Not too much. It just feels kind of weird. Um, and of course, it makes eating a little tricky. You know, I don't have these teeth touching when I close my jaw. Um, besides that, I don't,
Have you, what do you think of your profile? If you have you seen, remember I asked you to take a look at your
yeah,
a picture of your
uh-huh,
of something in profile.
right. My jaw this way, I don't notice it as much until I smile. Looking at pictures, I think before I had this issue, it seems a little bit more narrow. So, of course, when I don't know if my jaw's grown in the last several years. I mean, I'm sure it probably has since I've grown. But looking this way, um, my lower jaw is very pronounced compared to the rest of my features. It seems like the lower jaw kind of just takes over. um, and not that, I mean, I've kind of lived with it, so I don't really notice it too much until you kind of just like hone in on this area of my face. Um, so, yeah.
Okay. Well, that's a great answer and certainly an appropriate answer. So again, for those that are listening, especially the public who are not dentists, doctors, what has happened here is that over 8 years, the orthodontists, both the general dentist to begin with, who didn't last long, but the orthodontist who spent better part of 8 years treating this with head frame and Frankel and traditional braces and wires and brackets, focused on getting the teeth to fit together, but didn't pay any attention to the actual growth problem. Um, this is the first time that you had mentioned. I did not know that it was discussed early on that if it didn't work out the way the orthodontist had predicted, then it would be necessary to go in and I put it in quotes, break your jaw, because we don't break anything. We do cut bone, but we don't break anything. But actually started treatment without actually knowing or predicting how the jaw was going to grow. And so in your case, they knew that there was a jaw growth problem, and whether it was your parents' decision or whether however it came to be is kind of irrelevant. The point is the treatment was begun without knowing, rolling the dice and not knowing exactly how the jaw was going to grow. And now at age 23, I believe, Katie, right?
Mhm.
At
Yes.
age 23, your teeth fit together, but for those that can see the video, Katie's teeth fit like this. This is the position. Is that correct? Can you see this, Katie?
Yes.
What the orthodontists do is when they're doing all this 8 years of treatment, they make sure that they get the cant or slant to the upper teeth as much as reasonable. And then because the jaw has grown too far forward, they take the lower teeth, which are supposed to be like this. This is a normal anterior bite. And instead of the jaw being out here now, they just move these teeth back to the point as much as they can. And in Katie's case, this is her anterior bite right now. Is that true statement, Katie? So, but the jaw is still out, way out here. And so Katie and I have talked about this a little bit. I don't even remember what Katie made a decision. I think she's still thinking about it. But I told Katie, I said, now we've handled the jaw joint issue with pain, and it is definite that it should be done when a orthodontist is considering a bad bite problem to consider advising the patient or parents, adults if you're adults, or the parents if it's a child, that if you think that there may be a jaw growth problem, that you need to wait until that growth is shown to be either extreme or minimal before you go off on a long tangent of treatment that ends up with a less than ideal result. Okay. I don't want to lead you, Katie. I'm doing this really very transparently. Would you say that the way that the orthodontics ended up, is it a less than ideal result, or is it?
Yeah, I think it makes me question a lot if they had started later, if I could have had both success with straighter teeth and a better bite. Not that I think it's pointless. I'm glad I don't have an underbite, and that I haven't had it,
So your
I just wonder if it was worth it,
yeah,
to now have to go through all of this, if maybe it could have been avoided.
right. So again, for the public, the dentists understand this perfectly. This is not an ideal bite. This is the ideal bite. But she has occlusion, and you're chewing your Cheerios without any trouble. And you got a wonderful husband who's going to keep us all safe. You said he is a state trooper,
Hmm.
so
Yes.
he can keep us. He's going to keep us safe on the Tennessee highways. I appreciate that. And but Katie and I did have a discussion that if she had any interest and need to, now that her TMJ symptoms were at bay, to actually fix the jaw, it would necessitate, and this is the part that I even hate to say in front of a patient, especially a patient who has gone through orthodontics 2 separate times, and in one case, 8 years of head frame and Frankel, that if she wanted the jaw placed in the proper position, she'd have to go through another course of braces and a surgical event. Obviously, for the dentists out there, you're very familiar with orthognathic surgery, the kind of surgery I did for 50 years, and that the ideal scene is to inform parents early on that the best thing to do by far is, if you suspect a jaw growth problem, to wait until it is developed adequately. Usually I always recommend it to wait until you're 14, 15, or even 16 before you commit to either addressing the dental problem, and if you can't fix it with orthodontics, then you have to recommend the surgical, but you do it concisely. A treatment plan, orthodontic and surgical plan, is generally about 2 years. You got 18 months of orthodontics and a surgical event, which takes one day, and then but the healing and everything goes on about a couple months. But orthodontics and surgical event together is a couple years in comparison to, in this case, and asked Katie this as I was talking to her. I said, this is fairly extreme. 8 years of orthodontics, when the whole thing could have been handled in 2 years by waiting longer before you committed to a treatment plan. And that is my issue for today, and that is the title of this episode, which is the correct role for orthodontists treating TMD. Katie, I don't really need to carry on any longer. I think I've made my point, and you're very helpful on this. I know you currently haven't been discharged from treatment yet, and I'm going to kind of be waiting to find out if you are going to be totally happy with the way things are, or if you want to talk about getting the jaw surgery done and some more orthodontists. That's totally up to you. As
Yeah.
I tell all my patients, and I know I told Katie this, my job, because I don't do surgery anymore. I quit doing surgery about 5 years ago, and I'm totally committed to the non-surgical treatment of TMD. But I tell my patients in these kinds of situations that my job is to tell the patients the facts as I know them, inform them, educate them, and then make a recommendation. And then it's up to the patient to decide what they want to do. And that's fine with me. Whatever the patient wants to do is what I want to do. So that kind of summarizes what we want to talk about today. Katie, do you have any questions about, it's totally fine, transparent. Do you have any questions for me of your current treatment or anything on your mind that you want to ask me before we end it up? And I'm sure you're scheduled again to see me sometime. When did I want you back?
I come back, I think, in 3 weeks.
Okay.
So,
All right. Well, I follow. We're not ready to discharge you yet or give you PRN. So,
right.
But did you have anything you'd like to ask or anything you'd like to say to the public about this? Anything on your mind?
No, I love that you have this podcast though. I mean, I had no idea what TMD was, how it's treated, and it kind of shocks me how many people actually have to deal with this, and that's kind of sad, That's having it is so uncomfortable. So it's just great that there's actually people who are knowledgeable on this and won't just dismiss it and want to treat it.
Well, with that said, I do want to make one more point. Malocclusion, we call them functional malocclusion, and Katie has a functional malocclusion. Any dentist would agree with that. A functional malocclusion creates temporomandibular joint problems. There are only three causes for TMD, which is bruxism, clenching or grinding the teeth, acute trauma of different varieties, and then, of course, number three is functional malocclusion. And all the dentists and all the orthodontists, and for particularly the parents and patients, adult patients, should understand that having a bad bite, a functional malocclusion, frequently contributes to or is the initial cause for damage to the temporomandibular joint, which necessitates sooner or later symptoms and treatment. So with that, I'd like to end it. Katie, I really appreciate your time. I am just so tickled that you're a patient and that you're so lively, and that you're with your new marriage and everything. You're often having a great start in life.
Thank you.
Katie, I'll see you in 3 weeks. And for everyone listening, I look forward to the next episode of TMD Demystified. I am Tony Urbanek.